Okay. So go ahead. We'll go through these questions. All right. How we doing, everybody?
I figured out how to type on here, so
Oh, okay, nice. I'll give you like about 10 minutes to do that. And then I also I have your transcripts from this week's class, and I wanted to just show you some things on there too. So I noticed that you guys were doing the worksheet. Did you find that helpful? I'll give you 10 minutes to fill this out. If you click on what you type, you should have like a little cross that comes up like this, and you can just move your like I just moved that around. I got like 2 minutes left, and then we're gonna start talking. All right. So let's talk real quick. Okay, so how can we tell that a patient's memory is intact? Well, we want them to be able to state something that it is, because we know people with dementia and Alzheimer's, what's intact with them. They usually have that long-term memory. They could talk back like from when they were younger, but they have a really hard time with their short-term memory, correct? So, a lot of times you'll have people at the doctor's offices give them 3 words, and they'll usually be there for a while, and then they'll ask them an hour later what those words are. But a really good assessment is if your patient comes in and they can tell you, for example, like what they had to eat for breakfast, that morning. That would be a really good way of knowing, okay, because then that was just this morning that happened. So that's really good. So you're thinking this is something that was recent. How can we tell someone understands teaching about Parkinson's disease and changes that can occur? So what can you tell me about Parkinson's disease? What do these folks do?
Like the changes that occur with Parkinson's, you'll have like muscle rigidity, they'll develop, they shuffle when they take steps, they develop tremors.
Mm-hmm.
Um, um, yeah, I went
Very
blank.
good. That's very good. So when you have these test questions, this is what I want you to remember, is that this is good because it sounds like you all have studied. Just remember that you got to pick the best answer. So your patient might have a hard time eating, right? So you know what I mean? So to get him his nutrition, we might need to improvise, right? We might need to break it down into smaller sizes, right? For the patient, so they don't have to do as much chewing. Does that make sense? So what are some risks for lower back pain in older adults? We have osteoarthritis, scoliosis, hypocalcemia, spinal stenosis. It's very good. Very good. What teaching would you want to give a patient with cerebellar dysfunction? So this was on your worksheet that I gave you, huh? So what could you tell me about cerebellar dysfunction? What's the cerebellum? What is it responsible for? Does it affect your balance?
Fine motor, fine motor skills, balance, fine muscle, like, yeah.
Yeah. So, yeah, so whenever your patient's going home, do we think he's going to drive himself to his next appointment? No. So, well, then this next one here. When would the nurse contact primary care physician in regard to cervical discectomy and spinal fusion surgery? When the airway becomes obstructed or the patient's breathing is ineffective. That is exactly right. So a lot of these, if it's in the cervical spine, sometimes in the upper thoracic, right? Think of where the injury is. This can hurt a lot of our autoregulatory things such as breathing and our cardiovascular system. So we always want to think about like breathing, assess airway. If there's something in the answers that has to do with airway, remember I always told you want to ABC and sometimes read those answers. That's very good. What would the nurse do if the patient had a CSF leak? Lay patient flat and notify provider. Yep, keep the area clean. Very good. All right, so how would the nurse care for a patient with cranial nerve, the second cranial nerve impairment? Okay, so, let me see. Provide assistance with any activities that require vision. Arrange food and clock. Orient the patient to where objects are located by telling them, and the patient feeling. Very good. Whoever put that down, very good job. Okay. Family caring for a patient. How do we educate the family caring for a patient with Alzheimer's? Install door locks, remove scatter rugs or the throw rugs, have good lighting in the home, lock away chemicals, remove clutter, lock thermostat, water heater, and have a shower chair. Okay, very good. That is really, really good. Let's see. What are some complication risks associated with anterior fusion surgery? What do we think? We were just talking about, so anterior cervical fusion, so it's in the front, right? What do you think we are at risk of? What's here?
The throat, your
Mhm.
airway.
Your airway. What lies behind the airway?
Be the spinal cord,
Right, the esophagus.
esophagus. Yes.
Esophagus, and then okay, so what are we worried about? So we're worried about airway, of course. You said that. Are we also worried about
Dysphagia.
yeah, or dysphagia, right? So difficulty swallowing. What else? There's a lot of things that could be. So when you answer those questions, what I want you to think about. So if they're doing surgery anterior, that's in the front, they have to go through to the cervical spine. So you have to go through all these layers, have to go through. There's a lot of things that can be affected. And I want you to think about that whenever you're taking the test, okay? Think it through. All right, so lumbar puncture. What would alert the nurse to contact the primary care health provider? Very good. Or they wouldn't be able to perform the puncture due to skin integrity, right? So think about that. All those things that could, the skin integrity issue, that's a really good answer. Good job. All right, so let's see the next one. So we have zinconitide, okay, for chronic back pain. What information would you want to know from the patient? What would you want to ask the patient if they were on this medication? So I'll let you go ahead and Google what that med is. What is it used for? We'll come back to it. So what nursing interventions do you want to perform on this patient that has the halo fixator? They have pins, right? Do we want to do anything with those?
Monitor the pin sites for infection, make sure they're clean, etc.
All right, Rebecca says, if there are any problems with mental health for zinc, yes, that's exactly right. So we want to look at the pin sites, right, for infection. What else would we do?
Monitor the skin integrity, like where it's like right here on like the shoulders. Make sure that there's no skin breakdown.
Very good, because it rests on like the back, the shoulders, right, the chest. So we want to do a really good skin assessment. Very good. All right, so let's talk about the Glasgow Coma Scale. Did you guys review that on that little worksheet? I put that on there for you guys, and I'm sure you guys have that in your notes as well. So if you have a patient, your patient has a tumor, but your patient's opening up their eyes, and whenever his name is called, he mumbles in response to the questions, and he follows commands. So if you were documenting that, what number would you give him?
$13,
Very close.
$12.
Yep. Yes. Okay. All right. So you have a high thoracic spinal injury. Okay. What are we worried about? Breathing. So we want to encourage them to so if your client states that he's going to use do breathing exercises, that would probably be appropriate, correct? Yes. All right, so let's see here. Let's talk about sertraline. What is sertraline?
Zoloft.
Mm-hmm. That would be Zoloft. Okay, so. What do we use that for depression? Are there any secondary uses?
Alzheimer's.
Well, does it improve?
Does the Alzheimer's improve?
Uh-huh.
No, but their behaviors do.
Very good. So tell me about how would you instruct your patient? What would you give instruction to your patient regarding post-surgical, after they've had a cervical spinal fusion? What would their instructions look like?
Wear your brace. Limit your neck movements.
Mhm.
Don't turn it. Use your incentive spirometer.
Very good.
Um,
Very good. Okay. So what are your concerns for the patient who has spinal cord injuries and they're on bed rests?
Like pressure sores?
Uh-huh. So what would you as the nurse want to do?
Turn them.
You want to turn and reposition. Mhm. What else?
Add the bony prominences.
Right. You want to make sure that you want them off the bony prominences. Do they have you have to order something special in the hospital? Can they sleep on a regular bed mattress or
An air mattress.
okay? So what would you as a nurse do for someone who's admitted and they're in the early stage for Alzheimer's? They came to the hospital because they're experiencing something else. So what would you do to ensure that like you're addressing the Alzheimer's as well? They're early stage, and that's not why they were admitted.
Would you keep orienting them?
You could keep orienting them to keep them in what kind of environment? You want to keep them in a structured and consistent environment, correct? You guys are doing really good though. Okay. So what is the first thing that the nurse should do for a patient with cervical spinal cord injury? And we've been saying this. This is like it keeps repeating. It must be important.
Airway?
Yeah, so we want to evaluate that, right? Okay, so what are some complications of a traditional lumbar laminectomy with fusion? What would you want to report to the doctor if you're seeing?
Signs of infection?
Yep, you want to report signs of infection. What else? They just had surgery. We don't want to see CSF. What would that look like?
Clear drainage?
Yep. And then another thing would be if they've had the lumbar laminectomy. What happens sometimes? They have to go and do a blood scab sometimes. on people because they end up having a severe like headache, right?
Meningitis?
Well, that could happen, but you want to make sure they don't have any headaches from the procedure. And you want to make sure that if there's bulging, then we worry about what you were saying, the infection, right? Okay, so we have late stage Alzheimer's. And you would be very concerned about your client. If after breakfast he wants more breakfast, what would you say? You get him more food or?
A snack?
There you go. Yep. Okay, so let's see. We have a thoracic spinal injury 10 years ago. What would you want to look for? What, like if there's complication, what would you want to look for?
Curvature of the spine?
That might be. So she's 60 years old. Had this injury 10 years ago. So think about our 60-year-old population. You think she has osteoporosis maybe too on top of that?
Like any new breaks, maybe?
Oh, there you go. There you go. Yes, that's what you would want to look for. So like look at the age and whenever you're looking at these questions, like, oh, okay, so she's 60 years old. Okay. So what are some concerns as far as your client's coping strategies who just went through a traumatic spinal cord injury? What are you thinking?
Like how he's coping with it?
Mm-hmm. Yeah. Okay. What else? You think these folks are going to be able to go home and take care of themselves? What's important for us to know? We're sending them home.
They have a support system.
There you go. Yep. What else? How extensive are the injuries? I'd want to know is like, what is their level of, independence versus dependence, right? How much support are they going to need? And, this is a traumatic experience. And, you think about, I'm sure some of you have had some patients who were young and, I'll tell you, I had a friend whose brother was in a really bad car accident when he was like 19 years old, and he's about 48 years old now, and he's dependent upon his mother to take care of him because he was in a car accident when he was 19 years old. So this could be devastating, like, to someone like, that was the saddest thing, that I could ever think of that happened to someone that I knew because, he became very dependent upon his mom, and to this day still is. So we're talking about moderate Alzheimer's disease. So how could we educate this caregiver? She wants to prevent this patient from wandering off. What could we talk to her about? What do we think would help from this patient wandering?
Give them something to do.
We want to give them something to do, keep them busy. Exactly. Very good. So we have a spinal cord injury at T5. Blood pressure's up. It's up there. What do we want to do? So the patient has blurred vision and a flushed face. What's the first thing we want to check?
Glucose.
Well, blood pressure.
ICP, cranial pressure.
What is
ICP,
ICP? Well, their level of consciousness is okay. Level of
the
consciousness.
pressure,
Okay.
intracranial pressure.
So they have high blood pressure. What's the control center for your blood pressure?
Check the bladder.
There you go. Good job. So the nurse assesses the clients in the med-surg unit. What's the risk for patients with secondary seizures?
You mean like a head injury?
Did have a head injury? How about a tumor? You think that would be one too? All right, so let's see. Moderate Alzheimer's, we're going to discharge him. What do we want to include in our discharge instructions? For the caregiver. Go ahead.
Was it middle stage Alzheimer's? Give them something to do.
What else?
Them every day.
Anything else? We worry about them wandering.
Yeah, wondering. Yeah.
What would you want to do if they're wandering?
Lock the doors, etc. Put alarms on stuff. Make
Very
sure
good.
everything's. Make sure it's a safer home.
Do you guys watch Pittsburgh news ever? Anybody on here? Do you get Pittsburgh news? So I want to say, gosh, how long ago was this? There was this, I want to say it was like around 2009. And I think it was, I don't think it was Presby. It was one of the Pittsburgh hospitals. There was an elderly lady who had Alzheimer's, and she was a wonder risk. And one of the maintenance guys had to go repair something up on the roof of the hospital, and he left the door open, like unlocked. This woman went up there and walked off the hospital roof. They started doing a code wonder risk, and these folks, if they fall in a certain category, in the assessment, they get a bright green gown as a result of this. But that's horrible. Could you imagine like how that maintenance guy felt and how that nurse felt? And my gosh, how that family felt. That was awful. So yeah, you always want to make sure that they can't get out because they can injure themselves. Okay, so let's talk about MS. Okay, so if we have a patient with severe muscle spasticity and tremors, What would you as a nurse plan on doing to help manage the patient's concerns? What's the treatment?
Is that levodopa, carbidopa?
That's one. Yep. So what else did they give? You're thinking like something to help with the muscle spasticity.
Is this the one that starts with an R, like rope something?
Starts with a B.
Is it baclofen?
Yep, you got it. So we're talking about meningitis. Okay. What kind of personal protective equipment would you expect to wear?
Would it be gloves and and like a surgical mask for droplets?
Yep, very good. Okay, so tonic-clonic seizure. Let's talk about that. So you have a patient that went into a seizure and they lost consciousness. What would you do? What would you do first?
Turn them on their side.
Yep. So vagal nerve stimulation device. What are some common signs and symptoms of complications of that procedure? Think about where your vagal nerve runs, guys. Think about back to anatomy and physiology. Kind of like the same thing that me and Tyler were talking about before. Eating and what was the other thing, Tyler? Do you remember?
Breathing and eating.
So yeah, so you want to think about all those things. All right, so we have a patient with Parkinson's disease. What would you include as the patient's plan of care? Which interventions?
I'm just gonna take a guess because I don't know, but what about range of motion exercises?
Okay. So if we're thinking about with Parkinson's disease, we worry about swallowing, right?
Yeah. Yeah.
Or we were talking about that. So would we want to have them positioned when they're eating at a certain position so that they wouldn't aspirate?
30 degrees.
90 degrees.
Right, so 30 degrees or greater. Okay, so just remember that we're worried about aspiration. We were talking about them eating smaller bites during their meals, and we want to make sure that their bed is up. We're worried about that airway. Okay, we don't want them aspirating into the airway. All right, so we're going to talk about migraine headaches and propranolol. What are we worried about? What would we teach them about taking propranolol for headaches? What is propranolol?
You want them to check their pulse daily.
Check their pulse. Would we want to withdraw from this medication abruptly? Why not?
I don't know the exact reason why, but I do know you're not supposed to stop a beta blocker abruptly.
Would you have rebound?
Right, you can cause vascular changes. Yep. Okay. All right, so let's talk about, we have a patient that has an 84-year-old with cognitive decline. What would you anticipate is contributing to this decline?
Dementia?
Could be.
Is it an age-related change?
That could be.
What about a UTI?
Could be a UTI.
Hypoxia?
Yep. Very good. All right, so caring about Parkinson's disease, what would you teach the CAs on the unit about the patient with Parkinson's disease in regards to activities?
They're gonna need help with everything.
Okay.
Use a bed alarm?
Yep, we want them to be safe. We want them to use bed alarm. But we want them to be as independent as possible with activities. We do, but we would want to assist them if they need it, okay? So we have a newly diagnosed patient with epilepsy. And we want the client to be able to state back to us about medications. In regards to the medications, what do we want? What do we want them to tell us about? Should they wear a med alert bracelet? Should they drink alcohol while they're taking their meds? No. Should they talk to their doctor about any of the over-the-counter meds? Yep, because they can all interact, right? All right, so so what would you expect to be normal changes to the nervous system related to aging?
Decreased reflexes?
Decreased? Mhm. What else? You think they process stuff as quickly? No.
They're more prone for infection due to decrease in immune response.
Mhm.
Their equilibrium and balance isn't as good.
Okay. Let's see. So tell me about triptan or migraine headaches. When would the nurse withhold the medication and contact the primary health provider? Sumatriptan succinate, given for migraine headaches. When would we not give it, and when would we notify the provider for which complication?
History of cardiac conditions.
Very good. That's exactly right. Late stage Alzheimer's. Which assessment findings will the nurse anticipate? You think your patient will be mobile, late stage? Or your-
Agitation,
What's that?
agitation,
Right? Yep.
Incontinence.
Yep. Or do you think they could perform activities of daily living? No. And so it affects their brain and their functioning. So we're getting close here, guys. Oh, let's see. So when you're teaching a patient with new onset of epilepsy and they're prescribed phenytoin or dilantin, what are some things that you would expect to tell the patient about?
They're going to need to have lab draws, and there's I can't say it. It does this thing to the gums.
Mm-hmm. Yep. It cause dental caries. They need to have labs done. So will they have to keep taking a drug? Bacterial meningitis. What information would, like, if you're suspecting it, would you want to know? Who gets bacterial meningitis? What's that population?
College
Oh.
students
Yeah, well, where do they usually live?
in dorms.
Yeah, so you might want to ask about where they live, right? Okay, so Parkinson's disease. What key feature is the key feature of this disease? What will you notice? What will you see?
tremors,
Tremors, shuffling gait, slow movements.
Yep. Very good. Okay, so last one. Nurse assesses a client with MS. She gave him fingolimod. I can't pronounce that. Sorry. What is one of the side effects that we would monitor for?
What was the med?
I think it is. Hold on, it's FINGOLIMOD. Fingolimod.
Is it confusion?
No. Your face turns red. What do we call that?
Flushing.
Yep. Yep, and that's it, everybody. Here, I'm gonna stop sharing. I'm gonna close the whiteboard. All right, so we did our test review. And I'm gonna go ahead and stop the recording.